Hi guys, good evening. Dr. Jenny here, physical therapist and Dr. Physical Therapy, creator and founder of Balance and Fall Support Group in Aging Adults. Every Thursday, we highlight physical therapists, innovators, academicians, and we want to learn more from their knowledge and experiences. So for tonight, we are so grateful and honored to have a guest, and Dr. Sam Uy is our guest for tonight. Dr. Sam is a physical therapist, doctor of physical therapy, and also he is a board certified specialist in neurologic physical therapy. And he is the clinical instructor and the director of Brooks Rehabilitation. It is based in Florida. So it is have multiple setting, inpatient rehab, and he said this is the number one rehab in Newsweek, that
Based in Newsweek and
based
in
on
Florida.
Newsweek in Florida. Imagine that. Congratulations, Doc Sam.
Thank you.
Be part of that. That's really amazing. So Brooks Rehab is they have clinical setting in outpatient where Dr. Sam is being that's his setting right now. And then he has inpatient and skilled nursing. All right.
Illness.
So he's also an LSVT big provider and a vestibular therapist. So welcome, Dr. Sam. 23 years of physical
Yes.
therapist, guys. Yeah.
Yes. Thank you. Thank you for inviting me. I feel honored when you invited me to speak. And yeah, this is my first time, and hopefully you will learn a lot from me.
Yes, yes. Guys, so every time we invited to be highlights and of course to be in the Thanks God It's Thursday, we wanted to learn more about their knowledge, what tips they can give to us, especially in our time nowadays, that we want to always improve ourselves, right? So Doc Sam, can you tell us more a little bit about yourself that what I missed during my introduction?
Okay, and so at first I'm going to clarify because we have a director, regional director. So I'm a center manager in our clinic. So
Manager.
I want to clarify that one. So so what I miss? I think I've been 23 years as physical therapist. I was actually I when I was still in the Philippines, I got my bachelor's degree in the Philippines. I practiced it for about 8 years, and I was able to partner with a neurosurgeon. He's actually one of the best in the country, and I learned a lot from him through that because my first passion was really cardiovascular PT. I would like to be one of them. But because of this partnership, I was able to, he inspired me to become a neurologic physical therapist. So after that, all of my CU's learnings, everything would be neuro. And that's how I really grasped the neurological population. And then when I came in here in America, I practiced in, I don't know, 2017, I think I did my transitional doctorate, which is focused in neuro. And that's really helped me to prepare for my NCS exam. And yeah, and then that's it. And I did in my previous job. When I say previous job, that was 3 years ago. I was in this big hospital in Florida, working there for 7 years. That really uh, makes me practice more of my skills and really help out the clinic to grow their neurological services. Creating a lot of programs like vestibular program, primarily the neuro, and then we did more subspecialty in vestibular, concussion, Parkinson's. So after LSVT, actually, when I did my LSVT, I did my certification. One our chief rehab officer says like, yeah, let's just do the LSVT. Don't worry about it. There's not much Parkinson's there. So what we did, me and the OT went to the USF, which is the University of South Florida, and talked to their movement clinic there. And after that, they referred a lot to us, and sometimes we have 4 or 5 patients in a day, Parkinson's patients. So that's really it increases our population there for Parkinson's. So really, so creating a program is really you know, connecting to who you get your referrals from. That's really important.
Yeah, that's really nice. Imagine, and that's really good that you have a partner for an occupational therapist for the LSVT big protocol.
Hmm.
At least you will going to collaborate like the visits for PT, OT, and it's also better if you have the speech for the LSVT big loud, right? Yeah.
Yes, we do.
Yes, yes. And also speaking of LSVT, big is a Parkinson's Awareness Month today. Like April is the Parkinson's Awareness Month. So thank you for your service for especially for our Parkinson's disease population. So, Dr. Sam, what is your challenges? Speaking of Parkinson's disease, so you have Parkinson's disease patients, you have vestibular cases as well. And what will be your most challenging cases in an outpatient setting? Because you are there right now. Mhm.
Oh, okay. I think it's the I love spinal cord injury. I think that's no.
Oh,
Actually, I'm gonna take that back. I think my most challenges are the brain injury,
yeah.
especially if they have cognitive issue,
Mhm.
because cognitive behavioral issue, because that's wherein it's really tricky. I always ask help from my speech therapist and sometimes the occupational therapist, because they're the one who really have more skills on cognitive approach.
Yes.
So as a PT, we're more focused on movement, more focused on mobility. So that's why that's where we need to collaborate with our other colleagues.
Mhm. I like that. That's true. And also, Doc, Sam, we also have the certification in brain injury, right? We
Yes.
even have that. I think also there's a brain injury, some CEUs in APTA
Hmm.
even have that. So that's really challenging. I agree. I just have one, speaking of that. And then because of his cognitive issues, whenever you do history taking, you ask him seriously, he just answer like inappropriately, like he's like joking, he's like not serious, he wants to go home because he's really not straight, from that he is MVA and then it's also subdural hematoma, something like that, bleeding. So that's really tricky. We cannot make him stay even a week or 5 days. We went home the next 2 days.
Yeah.
That's how AMA wants to go. So
Yes, yes,
challenging,
true,
right?
true. I see a lot of those, and sometimes I have even one patient that the husband said like, okay, here's your boyfriend now. It's like it's talking about me because she loves going to. So that's the things like that. But it's it's even though it's challenging, I love challenging cases. So that makes me work more and research more, and and I think all of us as a clinician, we should have same approach also. If it's challenging, make that as a motivation.
Yes, just like our dementia patients, we use music just to lure them to do the therapy, We have they don't want some of them they don't want to the word physical therapy. We just call, oh, your exercise lady is coming. If you are the one, your exercise lady is coming. So it's just tough. That's true. Regarding your niche, you have neurologic, vestibular, and that's really good. So what are the courses or books that you want to share, Doc Sam, for our listeners?
Yeah, courses I would really highly recommend, because that's where I really learn a lot and open my mind about vestibular rehab. So it's Jeff Walters.
Okay.
Whether you're gonna see him in Medbridge or I think Summit, he's a really very knowledgeable and talented physical therapist, and he explained very well on any different condition, and he even have the algorithm on how to interview, and that would lead you to, okay, when this is the symptoms, this how this more like leaning to, so things
Oh,
like
okay.
that. And I think one best one also that I did long time ago, and I think Dr. Carol Lewis, and
Yes. Mhm.
so she got several courses, and
Yes.
I of course I attended her geriatric neurology
Mhm.
course, and that really gives me, I mean, it's very overwhelming. But they have the notes there to get you review, but it makes me broaden up more on my knowledge about neurology, especially for older patients. So
Yeah.
those are the two ones that highly recommended. Of course, attend all the CSM because all of the new
Yes.
stuff are there.
Mm-hmm.
So
One stop, and you have all the different sections there, right?
yes, yes.
Yeah, Dr. Carol Ann Lewis, she even have anything geriatric, and then she will have orthopedic at one point, now you said the neurologic. So that's really good. Very lots of knowledge and resources. Of course, her experiences is top notch. Yeah. So how about mentoring? If ever we have clinicians looking forward to learn more, what will be your tips? So other than the mentoring first is like, what will be your tip, Dr. Sam, if they want to improve their managerial role, or they want to pursue more in the leadership or something above clinical role, something like that.
So getting to that, I think it's really important to, just like talking about mentorship. It's really important that you have a mentor, because they're really gonna guide you to which path to go and which step to go. So me, I'm very observant person. So every manager that I had before, I always observe how they decide, how what their decision making is. You know, for example, I have a manager before, so I asked for a pads for Bioness, and it's really expensive. And he said, like, can we just divide this one to half of this month, and next month would be, and then for me, it's like, oh, okay, that's how you're gonna budget everything. Okay, so and that's how I apply it right now too when I do budgeting. And second, attend a lot of leadership courses, especially in your company, and
Mhm.
that's how I did in my previous job. I attended a lot of so we have like a kind of like a mini MBA that helps me a lot with little things, very important things to manage a clinic. And then I did also process improvement. We call it the Lean Six Sigma. I don't know if you know that. That's every company, they do that right now to improve efficiency on how their operation would go to their I mean in their company.
Oh, nice.
So I think really important is mentoring, and second is to observe your leaders, how they think, and whatever works, follow that. And of
Mhm.
course, when it doesn't work, then that it doesn't work. So
Yeah. So what is the best style when there's
Mhm.
something like kind of cases like that, or dilemma, Nice approach, best
And
approach.
one thing also I learned is don't decide when you're on the hype of your emotion,
Mhm.
because we are irrational when we do that. So calm down first before you think.
Yeah.
You know,
How to
and this
calm
up,
down? How to calm
huh?
down? We need to count.
No, it means give it some time.
Yes.
So don't decide right now. Decide tomorrow.
Okay.
Because that's gonna help you um being more rational on your decision. And this applies also when we most of you have kids. Maybe that applies how you mentor your kids. Don't say something when you're
Mhm.
mad,
Yes.
because you might say something that is irreparable, so things like
Yes.
that.
Even marriage, like you might regret whatever you say and you cannot get it back
Yeah.
because you hurt already that specific person or even a friend. Yeah, in general, that's really a great tips there. So how about for our listeners who wanted to learn more? So our balance and falls support group members, we have some of them are like caregivers, you're a neurologic specialist. They want to balance also LSVT big for Parkinson's. So they want to improve their balance. They want to prevent falls. So what will be your best tip for them?
You mean like improving
Exercise, or yeah, in
exercise?
general, yeah.
Oh, okay. Okay. Well, best tip is always seek for a professional to help you, guide you. Second is safety first. You know, so I always tell to my patient, like, oh, you practice this at home, but if you think like you're feeling weak right now, might give out, then don't do it. It's, so because safety first. And sometimes the caregiver also asks me, okay, can we do this at home? So I always gonna ask them, okay, if he gonna lose his balance, are you able to catch them? If not, then just don't do it. Because I like to challenge my patients, but and then I want them to bring that at home, whatever activities we do here in the clinic, then bring it at home. But I want to make sure that the caregiver that's going to help them is able to, you know, um, guard them, or when they lose their balance, able to catch them.
Mhm.
I mean that there's typical, like, they, let's say the husband is the patient, and then the wife would be like, can we do this one? And I was like, I don't know. It's like, if you're able to catch them, that's fine. But it seems like we might not be, so just don't do it. So
Yeah.
it's always like that.
Agree.
So yeah. So I think for the caregivers, always ask yourself, if I'm gonna challenge, um, if I'm gonna challenge my dad or whoever would be you're taking care of, am I able to catch them, or am I be able to do this one safely? I think that's
Mhm.
really important because we don't want to have another fall. Yeah.
Yes, yes. So that's also checking your skills, learning more. Caregiver education is very important during our therapy. So regarding this, I have a cat coming here. So regarding those cases, you talk about vestibular, we have Parkinson's disease. Majority of the cases you have in outpatient clinic, what's the peak or what's the most cases you have? And what's the best tool that you have recently? You talk about Bioness, right? So that's
Yes.
really a good one. We have also, I'm in acute, no, subacute rehab. And we have the Bioness and we have the big one, the bits.
Yeah.
So what are the great tools that you have there in your clinic and the maximum
Um,
cases?
right. Right now, since our clinic is just a little bit more than a year old,
Mm.
so when we open, we have the Excite. Excite is a functional electrical stimulator that
Okay.
has 12 lead. So if you know the RT300, the FES bike from restorative therapy,
Mm.
that's actually their other product, but it's more like you took off the FES from the bike and you just leave it by
Ah,
itself.
nice.
It's
Nice.
kind of like that. So
Mm-hmm.
you could actually put different um, uh, electrodes to different muscles so that they could accomplish, let's say, bed rolling or getting up from sitting, or walking, or even reaching. I have one patient that has scoliosis because of spasm of due to MS. So I'm putting FES here so that he's able to prop himself like this and then turn. So it's really more activity based stimulation. The bits we are waiting for our budget. So hopefully by this summer we're gonna get one. Um, we have also, for safety, we have an overhead harness. It's not the
That's
body
really
weight
good.
support. I would love to have a body weight support. That's what we have in my previous job,
Okay.
because I could really challenge even orthopedic with orthopedic patients. We have sports therapy in my previous job, and he has a patient who got post-op ACL, but only 50% weight bearing. So you put him on that body weight support, take off 50% of the weight, and have him run
Yes.
the treadmill. So those are really good devices, but it's expensive.
Yes.
our other our other clinic, they have the exoskeleton by Cyberdyne.
Yeah, I
The
hear that.
difference with this one is it detects electrical signals from the muscles before it moves. So it's not really trying to move for the patient, but it always waits for the patient to act before it.
Ah, okay, like active resistive. So they will move first and then it will activate more.
Mhm.
So that's really good. Yeah, so that's really good. I really love to learn more in innovation, because as we progress technology, especially I like robotic. I like audio visual like AI or augmented rehab. virtual rehab. We have lots of things nowadays. And then I like your body harness for safety because they will be more comfortable. Like they want to progress more and then they will keep thinking, who will hold me?
Yeah.
So it limits you to do more if they always think about that.
One
Yeah.
thing I like with the harness is that as a therapist, tendency we have this reflex wherein if they escape belt, when the patient loses the belt, you grab them right away. So you're
Yeah,
not really giving them a chance to correct themselves. So
that's
the
true.
harness, my hands are off, so I'm really giving them a chance to correct themselves.
That's
And
true.
also, second, it gives me more what do you call this one? More guts to put them on a treadmill. You know, it's
Yes,
because
yes.
I know if they lose their balance, they're just gonna be hanging
That's
there.
true.
They
And
don't
then
want.
it's really tough to challenge and progress more because they're about to, and then I limit them to do more, right?
Yes, yes.
It's just tough. And also for the safety of the therapist too. So
Mhm.
whenever you do some reactive balance, most probably, it's really tough to challenge them in some other functional activities or balance training. So that's really good. Dr. Sam, you talk about cardiopulmo a
Mhm.
while ago. That's also your first clinical role or setting, and then you became more on neuro. Can you give us more on tip for our clinicians who wanted to learn more about their niche? Is it like what will be your tip for them? Some of them they want more on ortho. Is it ortho for me? Is it neuro? Or how can they know that this is for them?
I think they need to check their background first. You know, like what are the most common population you've been treating, and then what are the population you're treating right now, and setting, because it matters also. When you want to do cardiopulmonary physical therapy and you're in the outpatient, you're in the wrong
Okay.
what do you call this one,
Setting.
setting. So you need to be like acute care or LTAC. Those are the good
Right.
settings that you get exposed with. If you want to be a neurotherapist, most of the time it's good to be in inpatient rehab or outpatient.
Okay.
You
That's
know,
true.
yeah, because a lot of neuro patients, you really need to challenge them and really force them to get up. You know,
Mm-hmm,
and
mm-hmm.
it's hard when your patient's really low level. I mean, you still could, you know, I don't know. Maybe it's just me on my as an outpatient therapist, because that's, you know, they're really more participative in outpatient, because you know they already mostly able to go around the house or outside. You know, so that's why we can really challenge them. Yeah, so that's really important. The setting is really important, because that's how you polish your craft. You know,
Mm-hmm, mm-hmm.
because you can't just be um, um, a specialist when you're not exposed to those population. You know, that's why we are called specialists, because we are more knowledgeable to it, not just by reading, but also by experience, right?
Yes,
So
exposure. Yeah, that's
yeah.
correct. Mm-hmm.
So and one thing also with because you're also a geriatric specialist, right?
Yes,
So one thing I learned with correct me if I'm wrong. Geriatric specialists, they say a little bit of everything, you
that's
know.
true.
But you're if you're that kind of person or experience, that's one good thing also to to be in. So I always when I mentor someone, I always ask them like, okay, what are your exposure? And I always tell them, whatever you read when you're reviewing to your board exam. I mean, when I say board exam, the specialist board, make sure you apply that to your patients, because that's what our knowledge they're reading it for, so that we can apply it. You know, and I always tell them, when you study, you apply that to your patients so that you could remember that one during your exam.
That's true.
Because if you're just reading it and you're not applying it, it's hard. You're gonna forget about. Like me, example, my weakness before is outcome measures. When I try to answer questions like, oh my god, I've been failing this one. So I always incorporate it to my patient. So even if it's not the standard outcome measures for the clinic, but it's the correct one for my population or the needs of the patient, then I apply that one, just so that I get used to using it.
Yeah, that's really good. It's easy to correlate, especially if you have when you're reviewing something, you have that book, you have that topic. Oh, Mr. Smith, I remember he's a stroke, and we have this laterality, he's hemiplegia, and then things like that. You remember Dr. Smith as right-sided hemiplegia, and then you have the TBI doctor. Let's say patient is Amanda or something like that.
Mhm.
You remember that I have one patient at one point think she's a TBI. And then all the cases, that's really easy, correct.
Yes.
Especially, and then you just put everything on that particular because experience, books, that's really needed to be combined. Yeah. That's really good. That's help. Is that part of your NCS tips for us? I'm about to ask this
Yeah.
too.
Yes,
Because
yes.
congratulations, by the way. And
I
then
always
although
tell
it's
that.
been a while, I'm sure. But how about especially NCS tips? So what book or what will be the style that we can review, Dr. Sam?
Okay, so this style, this is I'm gonna quote Dr. Beato because
Huh?
I learned a lot from him.
Dr.
uh,
B told me.
yeah, Dr. B, just simple things. What first thing that I learned from him: never tell anyone you're taking the exam,
Oh, I
right?
like that. Okay.
Yeah, and second, study first the one you are weak. So like
Okay,
me,
okay.
I it's more challenging for me to treat brain injury. So that's what I study
Okay.
first.
Nice, nice.
Because you can study later what we really know, like most commonly
Mm-hmm,
is stroke.
mm-hmm.
You study one later.
Gotcha.
Vestibular
Good.
rehab, I did that too. I study more of that, and that's how I learned Jeff Walters.
Okay.
So that one books. I get several books. I think vestibular rehab from by. Hold on, I'm gonna take this.
Oh, that's handy.
Yeah, this one by Susan Herdman.
Yes, I
That
have
one's
that
good.
too.
That
Mm-hmm,
one's
mm-hmm.
good. I think
Hard copy pa.
yeah.
Mine too, hard copy.
Yes, and always read a lot of clinical guidelines. That's really important
Itchy. Mm-hmm.
because it's either clinical guideline or systematic review because that's how they those are the questions that you're gonna get. They're not gonna do randomized control trial.
Mm-hmm.
Second is you do books, especially the fundamentals. Like I always say, if you're reading a neuroanatomy right now, motor control theory like that to study for the board exam, you're not yet prepared. You need to make that one as your reference. So you go to the clinical pattern guidelines. If you're not understanding what they're talking about, then you go back to fundamentals. You can't start from the fundamentals because it means you're not yet ready.
Oh, that's good point. See, at least you have those kind of skills. Check yourself, your weaknesses, your strength, and then also the time of the day. They have this specific time that some of them they really good at night to review, and then morning, and then what is the most effective way for you. And then I remember also when we review like the numbers at the end when you're closer, like all the love values and
Oh
everything,
yeah.
so something like that too. Yeah. So thank you so much, Dr. Sam. This is really helpful. We talk about a lot of stuff from leadership, management, your tips, exercise tips for the clinicians that wanted to learn more, the different resources, your cases. So, what's your plan? What's your future? I know you do a research as well, and
Mhm.
congratulations for doing all those abstracts last year. You had the CSM. So, thank you for all you do with our patients, and you're amazing, and we appreciate your contributions to rehab. So, what are we looking forward from you?
Um, Actually, I'm planning to do a lecture for a conference. So
Awesome.
just a local in Florida. So it's still in the works. So hopefully they'll accept my proposal. It's my first time. So of course I have a mentor by Dr. Amy is helping me.
Yes. Mm-hmm.
So she's always my mentor in these things aside from Dr. RB and
Yeah.
so I always look on these people, and I'm always grateful for them to help me, because these are the things that I like to do. You know, to be in research, to be also doing some lectures. I did some lectures, some little ways in some university, but I think for me, that's my next one. It's doing lecture in a conference.
Nice. Congratulations in advance and thank you for all you do. So how can we connect with you if they want to have a mentor, if they want to ask more about you, especially in neuro cases, outpatient or being a clinical instructor? So how can we connect with you, Doc Sam?
So it's very easy. Just find me in Messenger. So I could give you my email, samueljohn .uy @brooksrehab.org. But the easiest way is to just say hi to me in the Messenger, and I can help you out on whatever inquiries you have.
All right. Thank you so much, Dr. Sam. So guys, if you have any questions, you want to connect more, we will going to post Dr. Sam Ui's email and also her other information. I believe LinkedIn too. You have LinkedIn.
Yes, I do.
Yeah, we have LinkedIn, you have Messenger. So if you have any questions, connect with him. And we thank you again for connecting with us. And thank you guys for watching. And if you have any other cases or want to learn more, connect with us with Balance and Fall Support Group. Thank you for your support. And if ever you want to learn more about NCS, different courses that you want to check, just follow us with Physiogen, PT and Wellness, and Balance and Fall Support Group in Aging Adults. All right. So it's me again, Dr. Jenny Yusuf. I have Dr. Sam Oy. We are want to thank you for watching with us, and then see you again next week. Bye for now, guys. Thank
Bye.
you. Thank you, Dr. Sam.
You're welcome.